we're excited to welcome Andrea from the SHIP program, who's going to talk about Medicare under 65. But we're going to go ahead and get started. Just to let you know, the first portion of this presentation is recorded. And then you're welcome to put any questions in the chat, and Andrea will answer those after the presentation. We'll also be sending the slide deck and video to you if you've registered, and it will be available on our website. So I will hand it over to you. Thank you so much.
You are welcome. Well, thank you. I really appreciate the invitation to be able to talk today. I am the State Health Insurance Program Coordinator in Harford County at the Office on Aging. There are SHIP programs in every county, in really every state in the United States. It is a federal program. Our role is to assist Medicare beneficiaries, whether they're over or under 65, in helping to navigate their health insurance choices, give information, give referrals. We can assist with applications, and we are an unbiased party, so we can sort of give the whole scope of what's going on without, having any real skin in it as far as financial and that kind of thing. So today we are going to talk about making the transition to Medicare when you're under 65. But as I was saying before we got started, much of this also will pertain to people who are going on to Medicare because of age, so they're turning 65. Once you get onto Medicare, it's pretty much the same for everyone. So whether your clients or yourself, you're under or over 65, a lot of this information will be relevant. So next slide, please. So first of all, in order to get Medicare under the age of 65, you do have to be receiving Social Security disability income from the Social Security Administration. This is an application process. It goes by a judge. You do have to fill out and have a diagnosed disability that prevents you from being able to work a full-time job. And once you are granted that status and you begin to receive Social Security disability, you'll get a monthly income check from the Social Security Administration. The amount of that check is based on your work history and what you've paid into Social Security tax. You'll continue to receive SSDI until around the age of 65. I think some people choose to wait, and if they're able, until they reach full retirement age, but for the most part, some people will take it at 62, 65, just depends. You'll go on regular Social Security retirement. And sometimes that transition is a little confusing to people. Most of the time, the income will remain the same regardless. Sometimes it will change just a little bit, but again, in order to get Medicare under the age of 65, you do need to be receiving Social Security disability income. Next slide. Once you have gotten SSDI, based on your income, you could still be qualified for medical assistance. There are medical assistance and Medicaid programs that are available to people prior to going on Medicare, and they will have different income guidelines than the Medicaid programs that are available once you're on Medicare. And we will talk about that later in the presentation. So sometimes people will get SSDI, and then based on whatever that amount is, they still are receiving full medical assistance, either through their state Medicaid agency, which is usually the Department of Social Services, or through the Maryland Health Exchange, and they're getting a Medicaid-based program through there. So once you receive your SSDI, this is when your road to getting Medicare will begin. And as I said here, it's a 24-month process, and that 24 months can be either an actual real-time 24 months, so you actually go 2 years, and sometimes it can be what I'm calling a virtual 24 months, which can sometimes be confusing. So next slide, I will explain it a little bit in the next slide. So let's say that you applied for Social Security disability in June of 2022, and it takes a year for your application to be processed and to actually start receiving the Social Security disability income. However, when that application goes through, the judge actually backdates the start date to June of 2022 when you actually applied. What this does is it actually speeds up that first year. So 12 months essentially is done in the first month that you actually receive income, which means now you really only have 12 months until you get to being on Medicare, because those other 12 months kind of happened while you were still in the waiting process. And that is sometimes confusing to people because they think 24 months, but it's only been 10 months. Well, it's because of how that date, that official date, is actually captured when your application is approved. Some people get approved for SSDI almost immediately, and so that 24 months is real. And some people wait a while before that approval process. Some people have to apply several times, and then they almost immediately go on Medicare because maybe it's dated back to 2 years. So that time frame can be different for everyone and how their situation came and played out. But it is 24 months. And in the 25th month, you will transition on to Medicare. Slide. So as long as you actually, get some real-time months happening, about 3 months before the 25th month, you should receive a packet that has your Medicare card in it, as well as some information about how to, what's involved in Medicare. You may get a Medicare and You book. And around this time, you should also get something from the Social Security Administration showing whether you have to pay for your Medicare Part B, which again, I'll get into when we talk about the costs. It's very important that as soon as you get that Medicare card, that you start to do your research on the other types of insurances that go along with Medicare, because much like with most insurance, whether it's commercial insurance, Medicare, Medicaid, there are certain enrollment periods that need to be adhered to in order for you to be able to subscribe to a certain type of insurance. And if you miss those enrollment periods, you could be in a waiting game 6 months, a year, if not longer, to be able to pick up the insurance that you need. So as I mentioned at the very beginning of the presentation, once people get onto Medicare, it's the same system for everyone, whether you're under 65 or over 65. And that can sometimes be a little confusing to people because they feel like maybe the benefits are different if they're 40 getting Social Security disability income with Medicare versus 70 getting Medicare. It's all one system and all of the rules are exactly the same regardless of how you got there. Everyone's in the same insurance policy. It would be very similar to everybody in your workplace, let's say, all have Care First, Blue Cross, and Blue Shield. It doesn't matter whether you have brown hair or blonde hair, everyone's benefits are the same. And that's really how this works too. Medicare has its own set of benefit assistance programs, so Medicaid, that go along with Medicare. And the income and asset levels for these Medicaid programs tend to be much lower than what they are with the regular medical assistance system, which can sometimes be a little disheartening for folks because while they may have been qualified for medical assistance in the past, once they get on Medicare with that same income, they're no longer qualified for any type of assistance. And again, it's really important to know all of your different options and to know when the deadlines are so that you don't inadvertently miss them. Next slide. So what is Medicare? Medicare is a federal insurance program that's administered by the Centers for Medicare and Medicaid Services, which is abbreviated to CMS. It is for people both 65 and older, any age and disabled, or that are diagnosed with end-stage renal disease, or actually ALS as well. Those two diagnoses can allow people to also qualify for Medicare. Medicare is, you have two options when it comes to how you want to have your insurance your health benefits covered when you have Medicare. Option one is that you have what they call original Medicare, which is Medicare Part A and Part B. In this option, you would also have a secondary insurance. This could be a group health insurance if you're still working. It could be a Medicare supplement. It could be Medicaid. And then in addition, you would have to have a prescription plan, which is called Medicare Part D, or you could have prescriptions through a group health plan, again, if you're still working. Option two is that you have what's called a Medicare Advantage plan. This is also referred to as Part C. And a Medicare Advantage plan is kind of a bundled plan that includes your hospital coverage, your medical coverage, and your prescription coverage all in one package. There are different reasons to take one option over the other. A lot of it has to do with your health and your doctors, and your budget would determine how people would make that choice. Next slide. So enrollment to Medicare will happen automatically for those who are receiving Social Security disability income. It also happens automatically for anyone who is 65 and older and already taking their Social Security. If you are not taking Social Security, then you would actually have to do the enrollment into Medicare. But for anybody on SSDI, this would happen automatically. Again, it happens in the 25th month after you have started receiving those benefits. Recipients of Medicare are referred to as beneficiaries. So in all literature that comes out about Medicare, they refer to people on Medicare as beneficiaries. And the automatic enrollment is for Medicare Part A and B only. So anything above and beyond that, you do actually have to make an effort to enroll in. So that would be something like a supplement, a Medicare Advantage plan, a prescription plan. You actually have to select those plans and do the enrollment on your own. Next slide. So at the top of this slide is an example of what a Medicare card looks like. You can see that it has the person's name. However, the name is on the card is how all communication will come. That name is usually generated from Social Security. Social Security Administration is who takes all enrollment into Medicare Part A and B, and Medicare Part A and B only. And they also are responsible for the payment towards your Medicare, which again, we'll talk about the costs in some future slides. Also on the card is your Medicare number. This number is made up of a series of numbers and letters. It is unique to each person. When I first started doing this job, so not, about 6-7 years ago, Medicare numbers were your Social Security number, but several years ago, they decided to change it to something that was just sort of a hodgepodge mix of letters and numbers for safety purposes. Also on the Medicare card, it shows when you got Part A and what the effective date was, and when you get Part B and the effective date. Those dates can be the same, or they can be different depending on each person's circumstances. This card is paper. It's just a paper card. It does come in the mail from Social Security. You can order other cards if you happen to lose this or needed another one. It can take up to 30 to 60 days to get a card in the mail. We always suggest to people to maybe put it in a little plastic protector, make sure that you keep it safe, and not to give your number out to anyone other than your medical providers or a medical facility. Medicare Part A is the hospital side of the Medicare insurance. This is the portion of the insurance that pays when you have an inpatient hospitalization, if you go into a skilled nursing facility, if you require home health care, or if you end up on hospice. Medicare Part B is the medical side. This is the part of Medicare that most people use the most, because unless you have one of these circumstances listed there for Medicare Part A, you're not really using that portion. So Medicare Part B is any outpatient services, anytime that you go to a primary care or a specialist, preventive benefits like mammograms and colonoscopies, durable medical equipment. So this would be things like a nebulizer, a diabetic pump, any medication that goes through a durable medical equipment, so oxygen, again, with a nebulizer, any type of medication that goes through the nebulizer, that kind of thing, is also a Part B expense. Medicare is an 80-20 system. So what that means is that Medicare only ever covers 80% of its allowable charge. It leaves 20%. That 20% can either be paid out of pocket by the beneficiary themselves, or you can get as different type of insurance to cover, like a Medicare supplement, Medicare Advantage plan, though those plans work a little bit different. Medicare does not cover non-medically necessary services. So, like, for instance, I'm trying to think of what an example would be, in like massage, and even massage therapy for the most part would not be covered. If you're getting some type of massage through physical therapy, that might be covered, but not massage therapy itself. Care outside of the US is not covered by Medicare, but Medicare is a federal system. So whether you live in Maryland and you're visiting Florida, you could still use Medicare in Florida because it is a federal insurance. Durable medical equipment, prosthetics, orthotics, and supplies have to be obtained from a contracted supplier. So sometimes we do get people who call and they're trying to get oxygen and they get it, but then they end up getting a bill and they're not sure why. So it's really important that anytime somebody is getting some type of DME, that they're making sure that the supplier they use is a Medicare approved supplier. And original Medicare Part A and B does not cover vision or dental coverage, which is huge. It does not, in some circumstances, like cataract surgery would be covered, but like LASIK isn't, regular vision exams. Some dental coverage, sometimes that's related to a bigger diagnosis, might be able to have some coverage, but your basic dental doesn't. Next slide. Again, so this just goes a little bit into the different parts of Medicare and what they cover. I already went over most of this in the previous slides. I will say, though, that Medicare Part A has no premium. There's no cost for Medicare Part A. It is the free portion of Medicare that you paid taxes into. If you did have to pay for Medicare Part A, if you didn't have enough work history, you do need to have worked at least 10 years and paid into taxes in order to get Medicare Part A for free. So if you had to pay for Medicare Part A, the cost does change every year, but this year I believe it's somewhere around $482 a month or somewhere in that vicinity. So it is pretty pricey. But yes, most people would not pay a premium for Part A. There is a deductible associated with Medicare Part A. A deductible is the amount of money that an insurance company says that you have to pay first before they start to pay their share. So in this case, the deductible for Part A is for 2024, $1,632. Now that is an per inpatient hospitalization deductible. So what that means is that if you had more than one inpatient stay in the hospital in a calendar year, you would pay this deductible more than one time. And then it breaks down the cost for how long you're in the hospital determines what your cost would be. Again, these costs are based on if you only had Medicare A and B, then these prices that you're seeing here would be something that a beneficiary would pay out of pocket. If they have some other form of insurance, they may or may not pay these costs because the other insurance would pay. There is no out-of-pocket maximum for original Medicare. So what that means is there's never a time during the year where Medicare decides that you've spent enough money and they're not going to charge anymore. It can just, keep going with you paying that 20% ongoing. Next slide. Medicare Part B. There is a monthly cost for Medicare Part B. Everyone pays for Medicare Part B. Now, there may be some circumstances in which the Medicare Part B is paid for people through a Medicaid program, but everyone does have this cost. For 2024, it is, I have a typo on the slide I just noticed, but for 2024, it is $174.70. It does change every year. Depending on your income, if you have a high income, this cost could be higher. It is called an IRMA adjustment. It could add cost to your premium for Medicare Part B, and that is normally communicated to you through Social Security. This premium is automatically deducted from a Social Security check each month prior to the check actually being deposited. It's taken off the top. Medicare Part B has a yearly deductible. So this is, once you meet this deductible for the year, you're done until the next calendar year. For 2024, it is $240. It has a co-insurance, as does the Part B, of 20%. So again, that 80-20 system. And if you do not enroll in Medicare Part B when you are supposed to, or cannot show documentation that you had some other form of insurance and that's why you didn't take the Medicare Part B, you could be subjected to a late enrollment penalty that would also add cost to your premium each month. I should note here that if you do get a penalty for any portion of, well, there's two portions of Medicare that would have a penalty, Medicare Part B and also Medicare Part D. If you get a penalty on either one of these parts, it is a lifetime penalty. So it never falls off. Once you have it, it just keeps going along for as long as you have Medicare. Next slide. As I mentioned, this Medicare Part B premium is deducted from your Social Security, whether it's Social Security disability or regular Social Security, it does come off the top. The only time that it doesn't is if you had some form of assistance that was paying it for you. If it is not deducted, so let's say, for instance, that you're over 65 and still not taking your Social Security because you want to wait until your full retirement age, then you would be billed every 3 months for your Medicare Part B premium. And Social Security sends you a bill in the mail and you would pay that in quarterly increments. Next slide. Again, premiums for Medicare Part B change every year. They go up by some amount of money. It's usually somewhere within $10 every year. As I mentioned, you could be paying a late enrollment penalty if you delay enrollment. So let me give you an example of where this might come in. Let's say that someone gets Social Security disability. They wait through their 24 months. In the 25th month, for whatever reason, they waive their Medicare Part B. And so they wait 2 years and then go, oh, wait a minute, I need that. And they go to enroll. At that point, they would have a late enrollment penalty that would cover 2 12-month periods. So you can see here it says 10% for each 12 months. And so that adds on to it. So if you had 2 years without Medicare Part B, your penalty would now be 20%. And it's 20% of whatever the current monthly premium is. So in this case, the premium is $174. Let's just say $170. So you would basically be looking at $34 a month added on to that for your penalty. So in this case, that person's premium goes from 174 up to 208 or whatever it is. So, and that's a lifetime penalty. So it's just going to keep being on there every month until you no longer take Medicare. Again, if you have limited income and resources, there could be state programs that could assist you in paying for this. Next slide. So why is enrolling important? Like we talked about, obviously costs could be higher. You don't want to pay those late enrollment penalties. Your coverage could be affected. There are some circumstances when enrolling in certain insurances, it's very important that you do it at the beginning or when you first go on Medicare, or else you may not have those choices anymore. You may not be able to purchase a Medicare supplement. So it's really important to adhere to those deadlines and make sure that you're meeting them. And that if you're unsure of what they are, that you're contacting your state agencies, your local SHIP program, so that they can help you decipher exactly what you need to be doing. Next slide. This is just a little chart that shows when you would actually receive Medicare based on when you enrolled. So as long as you enroll with so if we're looking at 3 months prior to the 25th month, if you are, in that month 1, 2, or 3, so really you'd be saying like month 24, 23, or 22, your coverage will start the first day of the 25th month. If you get beyond the 25th month, you can still enroll in everything, but there could be a delay in the start of that coverage. And depending on when your current insurance ended, you could end up with a gap. So we really always encourage people to have everything in place prior to the start of that 25th month so that they don't inadvertently be underinsured for a month or two. Particularly, that could affect medications and if you have doctor's appointments, procedures, and that type of thing. During your initial enrollment period, you can enroll in a Medicare Advantage plan, you can enroll in a prescription plan, and you can get a Medicare supplement if that's the option that you choose to go with. Next slide. So Medicare does have a general enrollment period. This happens every year. It's January 1st through March 31st. And it used to be that if you enrolled in Medicare during this time, because you had missed your initial period, your coverage didn't start until July. So it really left a big gap for people. At the beginning of 2021, they changed some rules. And now if you were to say enroll on January 1st, your coverage would actually start February 1st. So it's happening a little bit quicker. Why would somebody use this general enrollment period? So again, if for some reason somebody missed that initial enrollment period, they did not pick up the things that they needed, they chose to waive Medicare Part B because maybe their budget didn't allow for the cost, and so they just decided they didn't need it, but now they realize they do. That might be why somebody would use this general enrollment period to sort of catch up on getting the things that they needed. Again, even though you're using an enrollment period that is allowable, if you've missed your initial signups, you could still end up with a late enrollment period. So, I can't say it enough. That's why it's important to make sure that you're getting all of the things that you need when you first go on to Medicare. Next slide. There's also a yearly open enrollment period, and this is for anybody who already has Medicare. This is the one that you usually see all the advertisements about. It happens every year from October 15th to December 7th. Any changes that you make during this time take effect January 1st. So during this open enrollment period, you can enroll in a Medicare Advantage plan, which they sometimes call Part C, and you can enroll in a prescription plan, which is also called Part D. There is a lot of advertisement that comes out around this time of year. It usually starts in around the end of August. Lots of mail that's generated during this time frame. Advertisements for prescription plans and advantage plans, and it can be very overwhelming for a lot of people. But we always encourage people to look at their prescription plans every year during this time and make sure that all of their medications are still going to be covered for the following year, that the costs haven't gone up exponentially, that there's no big changes to their plan. This is the time. It's just a good habit to get into to make those reviews. Next slide. Sometimes there can also be special enrollment periods. These would be specific to individuals based on life circumstances. So let's say, for instance, you move, there's a death of a spouse, and that's how you got your insurance through, say an employer. You retire, something along those lines. You may end up with a special enrollment period that would allow you to pick up some things at that time. Some people never get a special enrollment period. Some people do, but they are available if you have some life changes. And they give you an 8-month window to be able to make changes to your insurance. Next slide. Medigap or Medicare supplemental plans are plans that are through private insurance companies, and they contract with Medicare. They supplement that 20% that Medicare doesn't pay. So Medicare or Medigap plans only cover what Medicare covers. So best example of this is Medicare does not cover vision and dental, so Medigap plans do not cover vision and dental either. Any company, not every company has to sell all the same plans. They can choose which ones they want to sell. The most important thing to note here, though, is that Plans that are sold for people under the age of 65 are only Plan A and Plan C. Now, this should not be confused with Part A and Part C, two different things. But Plan A, Plan C through a Medicare supplement are the only options that people under the age of 65 have. Very few companies offer a Plan C. The ones that do, they are $300-400 a month. That would be in addition to your Medicare Part B premium, so it's very costly. Most beneficiaries that I have worked with opt to go with a Plan A. Plan A only covers the 20% that Medicare doesn't cover. And that's important to know, because what that means is that beneficiaries with a Plan A would still be responsible for both the Part A deductible, the Part B deductible, and then the biggest piece of it is that if you ended up in a skilled nursing facility, so let's say you had a hospitalization and needed to go to rehab afterwards, Plan A does not cover rehab. So then you would only get the Medicare benefits for that. So it is good to have this type of insurance because it does help with that, regular 20%, but there's still some cost above and beyond, unfortunately. A Plan A through a Medigap, if you were to enroll in one when you first go on to Medicare, the cheapest option I've seen on the market is about $140 a month. And again, that is in addition to the Medicare Part B premium. Next slide. When can you buy a Medigap policy? The best time to apply to get a Medicare or a Medigap policy is when you first go on to Medicare. And the reason for that is because when you first go on to Medicare, you have what is called a guaranteed issue. During that time, insurance companies cannot ask any medical questions, and they cannot base the cost of the plan or your coverage on your answers to those questions. So that's really important, because when someone has to go through medical underwriting, if they have a lot of health conditions, they can be denied coverage from plans. Plans can increase the cost exponentially. They can place stipulations on the coverage. So it can be very difficult for particularly people under 65 to get a plan if they don't get it right away. Same goes for people 65 and older. Again, they would still have this guaranteed issue. It's still best for them to get a plan when they first go on to Medicare. Next slide. Medicare prescription coverage. This is called Part D. It is available for anyone on Medicare. They are, again, run through private companies that contract with Medicare to provide these services. You can receive your prescription benefits through either a Part D plan or through a Medicare Advantage plan if you went with that option. Medicare Part A and B, regular original Medicare, does not cover prescriptions unless, again, they are something that's going through a piece of durable medical equipment or an infusion or something along those lines. Next slide. Medicare Part D, average monthly premium, it's hard to say here because there's so many different plans. There's different reasons why you might take them, but I would say on average about $35 a month. Most plans do have a yearly deductible. It can be different based on the plan. Deductibles can range from nothing to $550 a year, depending on what plan you have. You have co-payments for the medications that you pay at the pharmacy. So when you go to pick up your prescription, it may cost you $5, $10, $40, depending on what it is and how your plan is set up. Things to consider with prescription plans. All plans have a different cost structure. They have a different formulary, which is the list of medications that they cover. The costs for individual drug needs change annually. So again, this is why you want to always look at your plan every year and make sure you still have the best one. And as I mentioned earlier, you can get a late enrollment penalty for not getting a prescription plan when you should have. This penalty is 1% for every month that you should have had a plan and didn't have a plan. So let's say you went a full year, your penalty would be 12%. And it's 12% of whatever they've decided the average premium for a Part D plan is. So let's just say, for instance, $35, it would be 12% of $35 if you went a year without a plan. Again, it's a lifelong penalty. It never drops off of your cost. Regardless if you change prescription plans, that penalty always remains. Next slide. So when can you join or switch prescription plans? Again, when you first go on Medicare, you can get a prescription plan. If you can get a prescription plan or change plans during open enrollment, October 15th to December 7th. And sometimes there are some other caveats in which you might be able to pick up a plan, but for most people, those are going to be the 2 times you can get one. Next slide. The best way to compare plans or see the information is to use the Medicare Plan Finder tool, which is on the Medicare website. If you go to medicare.gov, there's a button on the middle part of the page that says Find Health and Drug Plans, and it walks you through a series of questions that allow you to put your medications in your pharmacy, and then it brings back to you the plans that look like the best fit based on the information that you put in. That really is the easiest way, but you certainly can call your SHIP program. They can do that for you. If you use an insurance broker, they can do that for you. But that information is pretty readily available on the Medicare site. Next slide. Advantage plans. So I did happen to see a question pop up. So I know people have questions about Advantage plans, and I'm sure there'll be more at the end. But just to give you a general overview, Medicare Advantage plans, which are sometimes called Part C, are bundled packaged plans that include your Part A benefits, your Part B benefits, and your prescription coverage. Typically, they are HMO or PPO style plans. They're run by private insurance companies that, again, are contracted with Medicare. For most Medicare Advantage plans, you do have to use doctors, hospitals, facilities in that plan's network in order for your care to be covered. So they are very specific to each state. They are very specific to each county or each zip code, really. So what might be available in one part of the state of Maryland may not be available in another part. So it's very difficult to talk to a friend sometimes, even one that lives in another state or even one that lives, say, on the Eastern Shore, because they may have different options than we have here in Harford County, Baltimore County. So it's really, you got to look and see what's specific to where you are. The most important thing to keep in mind with an Advantage plan is that when you sign up for a Medicare Advantage plan, it becomes your primary insurance and Medicare becomes your secondary. And so where this really comes into play is that if you go to a doctor outside of the plan's network and the plan doesn't pay, the Advantage plan, Medicare doesn't step up and pay either. So in that case, nobody pays, which means you pay the full cost. And that's a lot of the times where people get themselves in trouble with these plans, is that they don't, understand the way they work and they end up having to pay for things that they shouldn't. So, here, when we counsel beneficiaries, I make sure to talk to them about their doctors and their specialists and wherever they go, so that we can make sure that it's part of those plans, networks, and that they're not going to inadvertently find out later that it's not the case. Next slide. How do they work? I talked a little bit about this, but the biggest way that an Advantage plan works is it's a cost sharing plan. So what that means is that every time you go to the doctor, every time you go to a specialist, anytime you have a procedure done, you're going to pay something. It's called a copay, and sometimes it's also called co-insurance, depending on what it is. So best example would be you have an Advantage plan, you go to a primary care doctor, and the Advantage plan says that you pay $20 for that visit and they pay the rest. You go to a specialist, the Advantage plan says your share is $40 and they pay the rest. Maybe you go and have an MRI. In that case, the plan says you have to pay 20% of the MRI and they pay the rest. So it's really important to look at the plan details and understand, so that every time you get, if you get to the doctor's office and they're quoting you, okay, it's 20, it's 25, that you know if that's correct and that really is what you should be paying. So I like to tell people it's kind of like a pay-as-you-go model. If you have a month where you don't seek a lot of health care, it could save you a lot of money. But if you have a month or a series of months where you end up going to the doctor a lot, or you have a surgery or a procedure, you could spend a lot of money that month. So you kind of have to look at it over the course of a year and not just monthly, to see really if you're going to have a cost savings with it. Next slide. What are the costs to a Medicare Advantage plan? So with a Medicare Advantage plan, you still pay your Part B premium. Again, for 2024, that's $174.70. Some Advantage plans also have additional premiums, depending on the plan. Right now, there are plans that are anywhere from $0 a month, as far as a premium, up to $150 a month up for a premium. So again, it can run the gamut. One of the things to note that is a little bit different from original Medicare is that there is an out-of-pocket maximum. So the highest I've seen is $6,700. I have seen some lower, but basically what that means is that for many of these Advantage plans, they're kind of putting a cap on spending. So let's say, for instance, that you had a pretty, you had a year where you sought a lot of healthcare, surgeries, that kind of thing. This plan does, these plans do say, okay, well, if you spend $6,700 out of pocket, you're done. Like anything for the remainder of the year will be covered at 100%. And again, every plan is different for how they set this up. Next slide. This here, I'm not going to go over this whole entire chart, but this here is just gives you an idea of the difference between a supplement and an Advantage plan as far as costs and considerations. It is always something that we have people really look at because there is a lot of advertisement about Advantage plans and people have a lot of questions about them. And they can be beneficial for some, but not beneficial for others. And so it's really important that you just understand the differences so that you can decide in the long run what the best option for you would be. Sometimes with Medicare supplemental plans, their premiums are higher. And so people immediately sort of are, sticker shock with that. But if they look at it over the course of a month and they really look at how often they're going to the doctor, what types of healthcare they're needing, it could still end up being a cheaper option based on what they have going on. Next slide. Maybe the next one. I'm not sure what happened with that one. Oh, you must have to click, click, click. Yeah, okay. So, this slide here, I won't cover it too much because it may not pertain to everyone, but this is just the difference between someone who's receiving SSI, which is Supplemental Security Income, and Social Security Disability Income. So anybody who's receiving SSI, this could be someone who has never had a work history, will probably not have a work history. There's a cap on this income set by the government. I think currently it's somewhere around $800 or $900 a month. For someone whose income is considered SSI, they would always be eligible for Medicaid, and most likely wouldn't necessarily be eligible for Medicare because, again, that work history piece wouldn't be there. For SSDI, again, not automatically eligible for Medicaid. So depending on what that SSDI income is, they could be eligible for nothing besides just the Medicare and then paying for everything on their own. So it is really sort of determined by each person's income. Next slide. These are the Medicaid-based programs that go along with Medicare. So they are called Medicare savings programs. And the two that go along with Medicare are called Qualified Medicare Beneficiary. This is abbreviated to QMB. This has a gray and white insurance card that is associated with it. This particular Medicaid program will cover your Part A and B premiums. It covers deductibles. It covers your co-insurance and your copayment. So it basically acts like a supplement. And then next to it, you can see what the income guidelines. These are gross income, so before anything comes out. And it also has an asset limit, which are also listed here as well. The other Medicaid-based program is the Specified Low-Income Medicare Beneficiary, also known as SLIMB. There is no insurance card for this because it's not really an insurance. It's basically just the state paying the Medicare Part B premium for this individual. That's all that it pays. So they would still be responsible for finding something for the 20% and any of the deductibles and that type of thing. Again, monthly income is listed here. It also has an asset limit. These are paper applications that you can get from the Department of Social Services and submit. And then there is like a yearly recertification that's required for these programs. And then there are two programs that are specific for prescriptions. The first one is called Extra Help or the Low Income Subsidy. Again, there's no insurance card for this. This is applied to through the Social Security Administration. It is an online application that is available on their website, which is ssa.gov. And this will pay the Part D prescription plan premium. It covers the deductible, and it keeps the co-payments for the medications down anywhere between $0 and about $8, depending on the medication. It also has an income and asset limit. And then the last one is actually a state program. It's called the Senior Prescription Drug Assistance Program, which we call SPDAP. And all of this pays is the Part D prescription plan premium. It'll pay up to $70. So let's say that someone's prescription plan was $35, then the state would cover the full cost. But if someone's prescription plan was $100, then the state would pay $70 and they would still be responsible for $30. It does not do anything towards the cost of the medications, but it does help pay that premium. This also has some income guidelines. They are much higher than the other ones, so a lot of people qualify for this. And an extra perk of the two programs associated with the prescriptions is that if you qualify for either one of those, it does give you the ability to change your prescription plan outside of the open enrollment period. The Extra Help program allows you to change your prescription plan 3 times during the year, and SPDAP you can change once. So this is helpful if someone doesn't have a prescription plan and they have never had one, and we really need to get them one. If they qualify for one of these programs, we can get them a plan much sooner. Next slide. So I am actually, this is where I was going to stop, just because I know we're getting on to the question time.